Hi everyone, welcome back to Beyond Your Knowledge. So remember that is interesting. Our basically is based on God's wisdom, and how we can help others. So it is on the fear of the Lord is the beginning of wisdom, and the knowledge of the Holy One is understanding. Why I'm talking about this? This is so important. That was Proverbs 9 to 10. It is very important that we, as doctors and physicians, we can get some knowledge from God. Not some knowledge, so a lot of knowledge from God and wisdom, so that we can help those in need. Okay, so remember that we are here to help each other, and the topic for today is going to be regions of the stomach, and we're going to talk about also some clues about H. pylori or Helicobacter pylori. Now, before we continue, I would like to share with you Proverbs 3:28-29. Sorry, I don't know. Proverbs, this one, and says that, "Do not say to your neighbor, 'Go and come again tomorrow, I will give it.' When you have it with you, do not plan evil against your neighbor, who dwells trustingly besides you." Amen. Well, so basically it just help each other. Regions of the stomachs, how we can break it down this. So first, I think that would be a good idea if we can get a picture here of your stomach and the parts of the stomach. Okay, so here in the stomach we're going to have, so first we start eating through our mouth, then go through your esophagus, and then then it's going to enter into your stomach. Now there are different regions of the stomach that we should consider and understand. So this organ, okay. Now after the esophagus, which is right here, okay, after the esophagus right here, so what else you will find? You will find the cardia section, which is this one here on green. Okay, now the cardia section has a notch, which basically this notch is between your part of your esophagus, and part of your fundus that we're going to review soon, the fundus of the stomach. And so between both two is sitting on the cardiac notch. Okay, so until now we saw the esophagus, we saw the cardiac notch, and then where we have, so we have the fundus of the stomach, okay, which is the one of the most closest one to your heart, so as well as the esophagus. Okay, for this reason you can anatomically you can see or figure out that the patient can get a heartburn, and then it could be that the pain is just worse as the patient has a myocardial infarction. Well, so now we enter into the stomach. So we saw the cardia, and the first part we saw in the stomach is your fundus. And so after your fundus, so you have your body, okay. So your body, the body of the stomach, which is this one here, it is interesting because so this is a curvy organ, okay. So that means that you have a greater curvature that go from here to here, okay. So this is the greater curvature. Now if you have a greater curvature, usually in anatomy, so you have one thing, you have two the other. So the one is the lesser curvature, which is right here. Okay, so I'm going to draw an arrow here, and this is the lesser curvature. Now so until now, so the esophagus, the cardiac nerve shows outside between the esophagus, sitting on the cardia, and the front we see the cardia in green. So we see the body. Now we are going to see after the body, so you're going to have the pyloric antrum, which is this one here in purple, pyloric antrum. Then after pyloric antrum, you enter into the pyloric canal. So one time you get closer to your duodenum, it's a bit more increase your pH should be, you know, not acidic for the duodenum. They enter into duodenum. Okay. Now there are a few more things that we should add here. So we saw that we have a pyloric antrum and a pyloric canal, and then we have the pylorus, which is right here. Okay, like that. So now after that we saw that, so the duodenum, and now probably what about if the patient has a pyloric antrum or pyloric canal? So pyloric parts of the stomach. Okay. So now we're going to continue with the parts of the regions of the stomach. So we saw the greater curvature, we saw the lesser curvature. Now, one time you are going to enter a region which is going to be the pyloric antrum, which is right here. But the pyloric antrum has the angular incisure, or also known as the angular notch. Well, so, and then you see here the purple one is the pyloric antrum. After the pyloric antrum come the pyloric canal. Okay, so and then after the pyloric canal, which is right here, you have your pylorus. Okay, so and then you get your duodenum. So basically those are the regions of the stomach. So now we can move on to see more things about, so why we're talking about this anatomy of the stomach, or the regions of the stomach, because I would like to introduce Helicobacter pylori. Okay, so Helicobacter pylori or pylori, so depends. So some people say pylori, other people say pylori. So but yeah, it's H pylori, or yeah, it's okay. Well, so Helicobacter pylori is responsible to cause duodenal ulcers. Okay, now it is important to keep in mind that. So I'm going to switch to blue so that we can continue with the pattern that we had before. And now the majority of the patients that we are going to see with duodenal ulcers are found to be infected with Helicobacter pylori. Okay, so how we can detect if the patient has Helicobacter pylori? Well, we're going to do an endoscopy, and then when we can do an endoscopy, we do a biopsy, and in the biopsy we can see the microorganism. Okay, now this microorganism can actually you can show this organism in the ulcer of the patient in up to 30% of the time. So if the patient had this ulcer there, so and then you just take this biopsy, and then you check and you get the biopsy, so 30% of the time you can find the microorganism there. Now Helicobacter pylori also colonizes mainly the antrum of the stomach. So basically it's causing duodenal ulcer, but it's colonizing the antrum of the stomach. So now we can go back and see in the picture what is the antrum of the stomach, so that we can so get better view. So where the Helicobacter pylori we're going to sit. He's going to sit here in the purple one. Now just painting a blue. Okay, so basically right there. But then you will see that the patient is going to have duodenal ulcer. But as we mentioned, so when you do the endoscopy, in 30% of the patients also you can find in the place of the ulcer you can find also the Helicobacter pylori. Okay, now move on. Yeah, so colonize the mainly antrum of the stomach, which is in the upper pyloric area. So where there are few acid secretory parietal cells. Okay, so So yeah, so it is important, so because the parietal cells are not that common in that area, so because they're not common, so the patient has less acid, and because the patient has less acid, so it is more exists the possibility that this Helicobacter pylori grows more. Okay, now the colonization of this gastric antrum by Helicobacter pylori is associated with increase in the gastric acid secretion, and the duodenal bulb is the areas exposed to this increase in acid production. As a result, areas of gastric metaplasia develop later colonized by Helicobacter pylori, with subsequent development of duodenitis or duodenal ulcers. Now, eradication, let's just mention this one here, eradication of the Helicobacter pylori, it is when you give to the patients antibiotics. Okay, so we give to the patient antibiotics. Now this treatment so prevents the recurrence of the duodenal ulcers, because we are basically eradicating Helicobacter pylori. Okay, now since we mentioned about treatments, let's just mention the treatment that we are going to give to the patient. Okay, so it is as follows. So we're going to give to the patient amoxicillin. Okay, also could be tetracycline. Now tetracyclines, we need to be careful that we don't give to kids less than, or children less than 12 years old. Okay, because yeah, so you know, sorry, yeah, so their bones, the teeth, all these things can be affected. Also one is a metronidazole, and always it is important that we add plus any of those to balance the pH. It could be ranitidine, bismuth, citrate, or bismuth subsalicylate, this is okay. Or PPI, proton pumps inhibitors. Okay, so basically those are that we can use as a treatment for this. Well, I think that basically we are done for this, and thank you so much for watching, and God bless you, and remember, we can do all things through Christ who strengthens us. Happy faith. God bless.